Then pass the sutures. Basically you need what I mentioned earlier, you need a single large enough almost 8.5 millimeter cannula driven single central working cannula and accessory portals as and when required. Never hesitate to put up portals rather than getting into a trouble and struggle. So once we put the main central working cannula portal, then you have to put the first anchor. If it's a big tear, put it in the posterior part. So that's your first portal. Once you put the first suture anchor posteriorly, you switch your scope already into the posterolateral portals. You have a better visibility. Then you take the bites from posteriorly and park the posterior portal. That is the reason why we are bringing our scope into the posterolateral part rather than keeping it in the posterior itself, because the posterior portal can be used as a parking portal for your posterior stitches, because almost always it is very difficult to retrieve the sutures from the posterior aspect of the cuff. Then you pass the sutures in the matter, in the vertical matters or horizontal matters depending upon the size of the tear and the quality of the tissues, and then followed by you put the anterior-most anchor and takes the bites anteriorly and park in the anterolateral portal. But should be very careful about the anterior-most stitch, because if you are retaining your long head of the biceps, be careful your stitch is not going through the long head of biceps. If it is gone through the long head of biceps, patient will find to have stiffness, pain, etc. and etc. So this is a diagrammatic model how you repair a cuff. This is a humeral head. This is basically a tear. So whatever right is anterior and the left is posterior. First you put your posterior anchor. So take the bites and park posteriorly. Because you can see the posterior stitches are wide enough. But once you come to the next ones, come to the anterior anchor, the anterior bites and posterior bites are more closer. But notice that whatever stitches taken from the single anchor should be wide enough. It shouldn't come in closer, because when they come to close each other, the contact area and the footprint become minimal, so the healing become less and there is high chance for formation of gap between the bone and the tendon. So then another thing, especially when you retrieve the sutures, almost always retrieve the sutures under the second pair, because if you take it over, then whatever remaining in the lower part become tight in your stitches so that it won't be easily move. And tie in order. Especially the post should be the most anterior and the most posterior limb of each 4 sutures, because if you pull from the posterior part, the tendon moves posteriorly, and if your anterior post is more anteriorly, then that tendon will spread. So that will prevent the dog ear formations. And never ever root over tight, because the over tightening is almost happens when your cuff is very tight, chronic and fibrotic. That is the importance of releasing the adhesions. So what you have to do, you cross the medial 2 sutures and keep the lateral stitches uncrossed. So that will give a complete pressure of your tendon into the bone, especially the footprint area. And most importantly, relax the sutures prior to the introduction of the lateral anchor, because if you pull too much into the lateral anchor, literature says that there is high chance for future tendon avascularity and tendon retear. So this is the final picture you can see. You can see the lateral wide 2 stitches are uncrossed and the medial stitches are crossed. So that will ensure that the tendon is completely closed into the bone and there is no gap is being formed in between.